Please help us create a safe travel experience by following the Centers for Disease Control guidelines. These guidelines wash hands frequently with soap and water and maintain 6 feet distance from others whenever possible.
Attention please. Due to the TSA, Transportation Security Administration regulations, unattended bags are prohibited in or out of all central terminal areas and are subject to security search. Thank you for visiting the Dallas-Fort Worth International Airport.
Oh, hey Faith. Wow, welcome. I'm traveling. I have my mask. I'm actually traveling, and I knew the time difference. I decided to go a little bit early today because I made a commitment that I would do this live video every Tuesday night. I think that's going to be a nice, consistent thing to do, because no matter where you are, there's always some nursing exam going to happen tomorrow. Now, what's on the test? I don't know what's on the test, but I just figured this would be a good time, good night for all of you stressed out nursing students to get and talk about some tests. So if you look in the back, I'm sitting at an airport, but I got you. So just say a little hello in the chat so I could see who's here. I mean, I can see how many people are on, but just say a little hello. Who's that? Oh, I'm trying. I'm traveling. I'm heading back to New York. I'm in Texas. I'm in Dallas. You know, I'm kind of a two-state. I have family in Texas. Hey, hello. I got you. Look, I'm telling you, I have my mask. Yo, I have my mask. Don't want them to think. Look, I found myself a nice, quiet place. So, I look cute over here. I found myself a nice, quiet place, so we're away from everybody. But let's just say hello to a few people. Hello. I mean, I've done Instagram from the airport. I've done YouTube Live. Little bit of glare. But, you know, hello, everybody. I hope you can hear me well. Not too many announcements behind me. Happy Tuesday. I hope. Hey, Ashley, I'm trying. You all have been so amazing. I mean, look at this bit. You know, I mean, who looks cute in a mask? Like, really? One of the things that I find, it's so awkward because communication, you know what? Now wearing this mask, I don't know about the rest of you. But I feel we finally recognize just how much facial expressions play in communication. You can hear somebody, but for crying out loud, you can't see their smile, can't see their teeth, can't see their frown. You know, there are just some things that is just, who's that? Hey, Andrea, good night. Okay, where are you? Good night. Oh, it's sunny where I am. I have about a 1 hour layover in Dallas, and I'm gonna head in a plane to LaGuardia, and I'm like, I'm gonna be in air for like 3 hours. I want to be consistent. I'm telling you, I am learning this YouTube thing. It's all about being consistent. So I want to thank all of you. This YouTube channel was the suggestion of a student. Honestly, had I done this years ago, it's dark here. Where? It's dark in New York? Oh hell, maybe I shouldn't come home. Look, it's 6:30. Look. It's light where I am. It's really light where I am. So anyway, so I'm just totally impressed. I'm totally flattered. I'm a hot mess, but you know, it's nice. Okay, behind the mask. Let me show y'all what's behind the mask. Hold on. What's behind the mask? Teeth still got to be clean. Still got dental hygiene. Oh, there you go. There's a little something you can see. This is good. So in the text box, who has a test tomorrow? I did this live last week, and Professor Sassa, probably one of your professors, your nursing educators, was on the live. I was very, very honored. So I was like 5 people, and I said, wow, this is like a nice private dinner for 2. Don't you worry, guys. Next year when my channel blows up. I'll, I can't believe I say that. I shouldn't say that word at the airport. Can't say blow up at the airport. You know, my bad. Please, give me some tips on what to do. I mean, I don't know everything. I don't know every topic. My plan is to have other educators come on. Hopefully, as this grows, there might be your own instructor who knows what's on your test, might be in the text box on some pseudo name, like hot teachers or some mess like that. But anyway, so who has an exam tomorrow? Let me hear. Let me see the text box. Who has an exam tomorrow? Now, if somebody comes over and says, so what's in your exam, Faith? Faith, what's in your exam tomorrow? Oh, Philip, I miss you. Hey, Philip. I told you. So don't you think this is a good idea to have this crazy video on a Tuesday night to calm you down, talk to each other? Oh, wait, Philip, I'm giving my half heart. Come on. Bam. Hey, Carmen. Hi, everybody. Good luck. I'm so happy. Oh, I sent the message to Professor Sasa, and I'm like, just tell them to come over. You're all in this together. Please. So what's on the 102 exam tomorrow? Oh, this bit is insane. Fluid electrolytes, shop. All of that on one exam? Yo. So tell me what everything ain't that the truth? Listen, y'all need to go hard. Actually, that is so loud. That is so loud with the capitals. I'm so happy. So listen to me. I'm telling you, I'm going to plan and work to try to get one of your 102 instructors to be on the next live. I'm going to have this every Tuesday. I mean, next week you probably won't have an exam, but there's some stressed out student because, I don't think we deliberately put you on. Well, maybe we do. I don't know. So fluid and electrolytes. Remember the days when it was just Lasix? I mean, that was so easy. Now you have Bumex. You got to do true kidney function. You have to do ABGs on this. So tell me what videos you've been watching. What videos have you been watching on YouTube? Not Sarah from Register. Girl, she's up to 1 million subscribers. Goals. Well, I don't really have those goals, but maybe 100. And who's that guy from Simple Nursing? What videos are teaching you about fluid electrolytes? Let me hear. Save us. Hey, Jason, you'll have 2 million soon. I don't know about that, but Sarah, Faith. I don't know about 2 million, but I've been watching Sarah. That's good. She just had another baby. We got to support her. I was so happy. Oh, I'm trying. Lady, they must think I'm crazy. Listen, I know some of you know me, and you've been so kind to me. It's if the type of summer I've had, I really could cry, but I just can't. I'm slowly getting back without being too bad. My mother died suddenly July 12th, and it's been beyond. I can't even begin to tell you what the past 2 months have been. But I mean, few of you already know that I've shared that with a few people. I'm not one, but life goes on. And so I'm in Texas, and some of you know why I'm in Texas. And it's just been 2 years. It's really been 2 years of really horror. And I keep saying a weaker person would be in a hole. If I wasn't a strong human being, I would not be here. One of these days when you graduate, I will sit and tell you weekly the horror that my family has been through from 2019 to now. But, my mother would be like, girl, you better move on. Life goes on. Thank you so much. Thank you. I don't say that for sympathy. My mother had heart disease. She had congestive heart failure. She didn't die of COVID, but probably a COVID casualty because had it not been for COVID, she would have come back from Jamaica earlier for her visit. But my mother has a long history of heart disease. So again, she's had 2 years ago, my mother was an event. My mother's a twin. 2 years ago, 3 years ago, my mother came off of a plane, went to Brookdale Hospital, was on a vent. You know, they sedated her, so she survived that. So the hard part about this was it was so sudden. She really wasn't having any, but you know, I've been through that. You know, and you know, of course, had to get a COVID test, had to satisfy the Jamaican government, tried to get there, but you know, I went there to say my goodbye, and I was able to. And I think I just want to share with you one of the last things I said at the funeral, because in some cultures, as well as the Jamaican culture, saying I love you is something that's something never said. And the last words I said there was, I came here to say goodbye and to say I love you to my mother. And I asked them that, you know, you should tell the people that you love, I love you. In some cultures, and I know some of you know, it's very difficult. They show love, but I'm working through it. You know, you couldn't tell from, you couldn't, yeah. So especially in the West Indian culture, you know, they feed you, they send you to school. And you never hear that word, I love you. And then you find yourself around, yes, and then you find yourself around your friends. Like, I left Jamaica as a child. I came in, all my friends are all mushy, gushy, hugging, I love you. And I found it so weird. So it took me a long time, you know, so I took that moment to tell them, you know, but I did. I thanked my mother for making sure I was fed, for making sure that, I mean, far from perfect, you know, because I got issues with the chick. Trust me, she's gone, but I still got issues, and that's why people go to therapy. But you know, my last words were, I asked the audience, the whatever, to, you know, tell the people that you love them. And on my way out, I told my mother I loved her, and I've been through. I'm working through it, but you know, life goes on, and she wouldn't lay down for too long. You know, my mother has a twin sister who has the same condition. So if y'all believe in prayer, say a prayer for that girl and me. So, but more, you know, let's be a little Freudian. Back to you and that test. Listen, even sorrow isn't going to get me to change, but I thank you all for your wishes for me. Lady, oh my God, Lady, you and Lena, I've been texting, worried about me so much, but I'm good. Not as fluffy. But anyway, so thank you thank you so much for that. So is it Simple Nursing does some good things on fluid electrolytes. I think he kind of goes a little extra. When I talk to educators about YouTube, they like Sarah. They like, so Sarah does some of the stuff according to NCLEX category. So shout out to her. And you know, listen, who knows, maybe next year somebody's like, you know, go to Cheryl's channel. But enough talking about me. I have a poll on the community tab about the COVID vaccine. What do y'all think about it? I mean, when this COVID vaccine is approved, who's taking it? I think my choices were, I will take it, I will not, it's too soon, or I forgot. What else did I put on there? Nobody? Lady, a super old lady. I don't know about superwoman. I'm trying. I don't know if it's mandatory for school. You mean mandatory like the flu vaccine that, you know, I know some of y'all get, especially you, Philip, with all them Filipinos in your family, you certainly can get. I don't know. I mean, I'm not an anti-vaxxer. I'm not a pro-vaxxer. I really just take the flu. Listen, come on, listen. Filipinos are my peeps. Come on, I know. I love them to death. I have Filipino friends in Texas. Whole bunch of them in San Antonio. I mean, I'm in Dallas right now. I have a layover plane. Let's see, but too soon. Yeah. So, you know, I think the people who are pushing for us to get the vaccine shall remain nameless. I said they tried out first. What you say? I said they tried out first. It may sound, I think it's just too soon, but I don't know. Are all of you in, you know, let them be the guinea pig. Like, you know, well, first of all, we know that historically, the bad horrible research was done on people of color and based on how they did. So I think we should flip the script and, you know, put it on them other people. All them people that see these. And politicians, let them put their children first. I know. I'm going to delete this video, but whatever. It's America. I still can do that. Uh, so let's see. So flu, yeah, flu. Okay, so let me talk about GI, just to give you an idea. Again, I don't know what's on your test. Like, look, this is what I traveled. I ain't got nothing. I ain't got nothing. So I don't know. I don't know what's on your test, and I have my mask. My GI is so detailed, ridiculous. Like, which nurse needs to know all of that? Ask the previous students who always tested on GI. Again, I don't know your test. I don't lecture the stuff. I know that they're usually very big on the diet. So, for instance, Crohn's, whatever the other GI shit. So, my bad. Diverticulitis. It would be the questions that I've heard students talked about previously when something like this. Your patient is newly diagnosed with Crohn's disease. Which of the following food items should be restricted? Something like that. Or which of the following, for instance, so gallbladder, they should watch the fat. Those are some of the type question. I mean, you can't memorize. So if I were you, wouldn't that be something if one of them questions on your test, you're like, damn, that's Cheryl. Listen, I'm at an airport. It's okay. So those are some of the questions, but I don't know how they do it now. But be prepared, or how do I tell you? I know 1 or 2 is a bad reputation for certain stuff. And listen, I don't know if one of the teachers listen, whatever. 1 or 2 is a bad reputation, whatever. You know the deal. Like you hear, they lecture one thing and test you. Who heard that? They lecture one thing, test you on another thing. That's what students have said. I don't know if it's always true. So read the book. It might be too late, but it's important to read the book. And be prepared that they're going to be random. You're not. What about GI meds? Did test heavily? Yes. Side effects. Andrew. My understanding is that it could be pick a GI med. A GI med. Your patient is diagnosed with whatever. Crohn's disease, whatever, and is prescribed this medication. Which of the following should you teach the patient? That's how it would be asked. So you would have to know what the common side effect is to teach the patient to say, oh, so that's kind of how it's those kinds of stuff. But I know it's always heavy on food because GI, not heavy, but always something. One of them diets, they shouldn't have nuts, and I don't know them. Like I said, I'm giving you this broad because I don't lecture the topic. But there's one of those GI diseases that you really shouldn't have corn or you shouldn't have nuts. So I would just last minute just kind of say list them. I would just maybe list all the GI things as one thing and just say, okay, so which food should they avoid? Sadly, we talk to you in fundamentals in normalcy that we don't teach anybody to avoid anything. We teach them to limit or in moderation. But when you go to 102, yeah, there you go. You did a list for diet for electrolytes. Oh yes, so definitely also electrolytes. I mean, so remember when you talk about electrolytes, bananas is not the only food with potassium. You got to kick it up a notch. They know that you've all memorized banana as a great source for potassium in 101. They're going to expect you to know some other. So when you're talking about potassium, also look for your foods that are rich in vitamin A. So a student, I don't know if I told you, a couple students did a presentation one year, and they called their presentation ROY, ROY. Red, orange, and yellow. Isn't that cute? Those are the foods that are rich in vitamin A. So some of those foods rich in vitamin A are also good sources of some good source of potassium, like sweet potatoes. People will say some tomatoes. You see how that works? So if you want to get a new boyfriend, say hello to Roy. I'm just saying, but not all. So whoever said that about listing, I would definitely do that. I would just. If at least one thing, I said, okay, I'm going to master what the diet is. So here's a question, since this is a patient who had their gallbladder removed, right? So let's just use that because that's a common, and patient who had their gallbladder removed, and of course, we're removing that sucker lap. We're not doing an open coli, right? We're doing that lap. Patient had their gallbladder removed. Patient says to you, I had my gallbladder removed. Does that mean that I can never ever eat any fatty foods? You like that stuff? What would be, okay, I'm sorry. What would be the nurse's best response? Yeah. Who wants to answer that question? What would be the nurse's best response? That's a question we test you on. A patient has had a lap cholecystectomy. The patient says to the nurse, does this mean I can no longer have any fatty foods? What would be the nurse's best response? I think that's a good question. Who wants to challenge? Who wants to answer that? Philip? Carmen? Lady? Nobody? Oh, let's see. Moderate amounts and take supplements. Oh, because you like to promote the pharmaceuticals, Philip. Yeah, somebody else. So far, so good. And avoid fat. Totally. So Carmen says avoid fat. By avoiding, you mean totally, like nothing, like how you avoid the thought, like totally. Philip said supplements. Who wants to expand on what both of them said? One says reduce. Yes, because you're not supposed to have two partners. Supposed to have the one. Reduce, exactly. So Philip says supplements. Can somebody expand on supplements? What supplements? Why supplements? A fat supplement? While you think about that, okay, lipase, good, right, exactly. Now, Carmen says reduce the fat, and that's and also right. Why can somebody who did excellent in anatomy lady? Can somebody who did excellent in anatomy tell me why they still can have a small amount of fat? Remember, how do we break down fat? And tell me why can they still? Why can they still have some fat? Oh look, ain't nobody behind. Look at that. Who gonna tackle that? Pancreas enzyme. That's enzyme. Okay, that's one. Somebody else. What if the organ can take care of some of your fat? Somebody. Lipase. Somebody else. Who? What are the organ, providing you still have some of that, can still help you handle the fat? Nobody? Oh, this is a good angle. You know it. It's the liver. Yes, yes. You're not guessing. Good guess. Good guess. When in doubt, honey, liver rounds. Absolutely. You still have a functioning liver. Yes. Hey, honey, listen. Yes. It's not the brain. It's not the brain. So when you no longer have a gallbladder, again, you don't want to over abuse your liver. Like, I know after you have the exam tomorrow, you're probably going to, put your liver through some little exercise to see if it works. But, yeah, so if you have a functioning liver, you have your gallbladder removed. Okay, you don't want to abuse your liver, because remember with fat, fat, gallbladder, bile, lipase, as Carmen mentioned. So as long as you still have a functioning liver, so I would do some stuff on food and that. Are the hepatitis on this exam? And if they are, good luck with that. Oh no, good. Whew. Good for you. Probably the next exam. So for the next one, you should remember your A, B, and C. So master fluid and electrolytes. That's always heavily tested. Acid-base balance. Fluid and electrolytes. Oh, what are the early signs of shock? Always. I'm telling you, I love that I don't lecture, because I can say this stuff. I don't look at your exam. I have no idea what your exam. Exam 2. Most of you, Simple Nursing does a good stuff on acid base. Most of you have memorized what are the signs and symptoms of shock. I know you have. However, you're often tested, what are the early signs of shock? So because that's really what it is. What are the early signs? What would trigger, what sign would a patient exhibit that make you want to say, oh man, let me call a rapid response? So, you think about the basic stuff that you've learned. When the pulse rate is high, what direction is the blood pressure? Those are some of the things that you have to, again, early signs. That's how they test. I'm just saying, or so students have told me. They usually test you on early signs, and you've been memorizing what are the signs of shock. Like what are the signs of shock is a good Jeopardy question. However, a nurse has the following vitals. What would the nurse do next? So or assessment, you may get a certain amount of data that looks like shock. What should the nurse do first? It's never call the doctor first. You know that. It's usually have to do something. It's just like if there's a fire. You're in the patient's room and there's a fire. Close the door before you do that. So I would look at it. So those are some of the tips. Oh, I board in 10 minutes. I'm good. They leave without me? Hell no. I'm not staying in Dallas. Those are the tips that I would do. I would look at what are the early signs of shock. Whether you've had that. The nurse, a patient is presenting with signs of shock. The nurse anticipates which of the following. So you should know, again, even though it's not the nurse's scope, to put the medical diagnosis and even the order, but you have to be prepared. For instance, if you know that a patient is a diabetic and you find this patient unresponsive, you're already running to make sure you have that D50 in your hand. You need an order for it. So similar with shock, you have a patient who you suspect, based on your assessment, is shocked. While you're yelling down the hallway, call a rapid response, you're heading for something else. So that's the expectation, that you've memorized the symptoms, you've memorized. It's almost, not hate to say it, but in many instances in medicine, a good nurse, an excellent nurse, when I call a doctor or nurse practitioner, most time I already know what I want them to say. That's really what it is. It's not your scope, and there's so much more that they've learned. They did have 4 years of medical school and way more clinical training. So, for instance, here's a simple example. You have a patient who has a temperature of 101.5. I already know. I've done my assessment. I went to Queensborough Community College, got my bachelor's later on at SPS. I know the sources that could be potential infection. Does the patient have a cough, any type of respiratory stuff? Nope. So it's probably not respiratory. Is the patient 85-year-old female, had a history of UTI, a little confused? Yeah, she probably got another bug of the month, and we probably know exactly what that is. So I'm going to call that doctor and I say, hey doc, it's Cheryl, your patient, she's here, temperature, well, if she's 85, the temperature is probably not that high. Temperature is probably 100.7, which is really high for an old person. Urine's a little smelly. Already know that. I know that doctor is going to say, okay, send a urine culture, send a UA while you're at it, may start an antibiotic right away, but I know that. So that's what we're asking you. But again, the scope. So for instance, why I tell you all the time, I think the R in SBAR is wrong, because it gives a new nurse, a new student, the impression that you're the one making the recommendation. No, I'm not. I got enough to do, boo-boo. I'm calling you with the first part, and then you's going to tell me together. I'm giving you all this assessment, and then you tell me what the recommendations are. Because guess what? Not every patient who is short of breath, on Lasix, still short of breath, needs more Lasix. That's what amateur nurses think. Oh, the patient's on 40 milligrams of Lasix and still short of breath. Well, guess what, boo-boo? Maybe it's not a Lasix issue. It could be a clot. Or do you know what a D-dimer is? Does the average nurse know what that is? So I tell you, be very mindful when you look at SBAR. It's not the role, it's not the scope of you, the bedside nurse, to know everything. It's your role to be able to know what normal is, and then be able to identify abnormal, know who to report it to, no urgency, no frequency, call them and say, yo, I can't do everything. What do you want done? That's my point. That's my little soapbox on the S bar. But yeah, so you should know signs and symptoms. That's how 102 tests. My experience, what students say. You've all been memorizing what the symptoms are, but they'll test you. They'll ask you, I'm having a bad try to remember all these signs and symptoms. I know. For a lecture, I think you should, for the person who said that, the best, how are you? The best, how are you? The best thing, you want to come, darling? Somebody here. Thank you so much. The best thing, one of my brothers out here. Say hello to my students, nursing students. Thank you. Good. He's cleaning up for me. Thank you. One of the best, I think the best thing you should do, you should memorize them high-low. So for instance, when somebody has a sodium imbalance, I always go sodium imbalance, mental, both. Mental. Somebody has a potassium imbalance, cardiac, high or low, muscle. I'm sorry, sodium, mental status, cardiac, muscle, also bowel muscle. So try to pick one organ. If you can pick one of your electrolytes, pick one organ that it may affect, and then how would you assess it? So for instance, if your patient has a potassium imbalance, whether hypokalemia or hyperkalemia, and you say that you see, I was good. Somebody came close to me, I put on my mask, and they left, and your girl is not. So person has hyperkalemia, and I know that it's muscle. Well, the most common way that people assess the heart is by checking the pulse. So an irregular pulse could be a sign of some type of cardiac imbalance. And again, muscle, you could have muscle twitching, muscle clamping in your legs, or you could have hypo or hyperbowel sounds. So if you think muscle, assess muscle. You think mental, if you think mental. So I would go through my list of electrolytes and try to pick a muscle. So pick at least one muscle and see how that goes. So I think that's the best I could do, and see all those other stuff. What else we got? I'm sorry. You're welcome. Who's that? Yeah, I mean, that's the best I can. And again, see, that's just from an experienced nurse trying to understand. I don't know what's on your test unethically. It's just so I would try to do those. I'm telling you, in my heart, I am hoping that tomorrow when y'all look at your test, you see something, you're like, oh, that's Cheryl. I know. But anyway, guys, listen, I hope y'all, I'm going to have to probably board in the next 15 minutes coming into LaGuardia. And I hope y'all do well. And, say a prayer para mi familia. We're going through a lot of stuff, a whole bunch of stuff. I mean, unreal. I mean, forget a book. 10 books. 10 books. Yeah, really, really 10 books. I mean, I know some of you know that, I had a cousin that was murdered last year. I'm telling you, I don't even know where to begin. Criminal investigation on the news, and trials postponed, and trials coming up again, and the minute anniversaries come up, the press starts to call. September 23rd was my cousin's birthday. The press starts to call. There's another thing in the news. So I've been just really not hiding, because I don't hide, but I've just really been minimizing social media, because there's just stuff that I can't. Any post I put, they share it. I can't even put a post that says September 23rd, my cousin would have been 31, and this, some news media posted, oh, the family's grieving, and it's just, as much as I'm so I figured it's a good place, I'm here just to help you. So I've been really low, not hiding, but just really, really, how social media goes. Anything you say, it's just, Anyway, I'm gonna leave. Let's see, I'm down by C4. They're boarding. So listen, guys, good luck on your test tomorrow. I have oh God, psych. Good luck on the psychs. Oh God. Yes, I was at a psych hospital early this year. I mean, not as a. I wasn't there as a patient. I was there. I don't know. I don't know. Yeah. Thank you so much. I'm coming through LaGuardia. It's so crazy. All right, listen, guys. Have a wonderful night. Be good. Good luck on your exam tomorrow. Be good. Let's see. Woo, be good. Good luck. All the best. Good to see you, Jason.